Hello, this is From Caracas. I'm Ray Gomez. On the treatment of Venezuelans who suffer from diabetes, thanks to a revolutionary Cuban medical program, I will talk with Dr. Antonio Jesús Díaz Díaz. Please join us for the next few minutes.
How are you, doctor?
Nice to meet you.
Thanks for being with us. How does the program of the good living from the diabetic get to Venezuela?
Well, the program The Good Living for the Diabetic arrives for the experience that the two revolutions had with work contracts, past conventions between both countries with the Barrio Adentro program. Then, it was converted to more specific programs.
Barrio Adentro is one of the priority programs of Cuban missions in Venezuela, specifically in terms of health.
Yes, then the experience of the previous conventions was convened and making agreements with more specific programs of chronic, non-communicable diseases. The incidence and prevalence of diabetic foot disease here in Venezuela decided by both countries to sign and open the agreement of the good living for the diabetic. With the experience that had accumulated in Cuba, with the development of the proper, that is a medicine that is specific for the treatment of chronic ulcers for diabetic patients, decided to bring this Cuban experience and introduce it in the country for the treatment of diabetic foot.
A Cuban medicine from Cubans, up to the time and manufactured in Cuba that from that moment begins to become generalized.
From the 90s, these medicines, which was developed in the Biotechnology Center in Cuba, and between 2000 and 2002, the clinical testing were started in the Institute of Angiology and Vascular Surgery in Cuba in 2006. It was patented in the list of essential medicines. Then, we began to apply it for the treatment of diabetic foot ulcer.
What is the medicine made from?
El medicamento está compuesto por el factor de crecimiento humano, el mismo factor de crecimiento humano que fabrica, que produce nuestro organismo, pero es recombinante producido a escala industrial. Es un medicamento sencillo, pero muy valioso, fue descubierto en 1900.
It is made from the human growth factor. It is the same human growth factor produced by our body, but in large scale. It is a very simple medicine. It was discovered in 1959. From that moment, different clinical testings were carried on applying this medicine. Our scientist, Dr. Berlanga, who has the wonderful idea of applying it intralesional, which means injected directly into the ulcer, among patients with diabetes, when conducting the clinical testings, we had successful results that until now, in the world, there was no medicine able to heal up the tissue.
Coming back to the Good Living program, who works in this program?
El programa de Buen Vivir acá en Venezuela está compuesto por un equipo de trabajo, tanto cubanos como venezolanos.
In the Good Living program here in Venezuela, a team of Venezuelan and Cuban doctors works together. It is divided in every state, led by a specialist in angiology and vascular surgery, who works together with Venezuelan and Cuban health promoters in education to train Venezuelan staffs how to apply the medicine and healthcare of patients with diabetes.
Ahora bien, tenemos un caso X, a un paciente que necesita ser sometido a este tratamiento. ¿Cómo se procede a intervenir a ese paciente?
For example, a case in which a patient needs the treatment. How do you treat him? I guess there is a treatment before and after the medicine is applied.
Perfecto, sí. A ver, nuestro promotor está integrado, el programa está integrado junto con el programa integral.
Well, our health promoters, the program takes part into the Barrio Adentro healthcare program, medical practices here in Venezuela. What we know as CDI, which is the local health clinic and the Venezuelan People's Medical Care Network. We work all together and publish where you can have treatment and where they can get specialized health care in diabetic foot ulcer with Heberprot-P. Once patients are referred to our consultation, patients are diagnosed to assess criteria and apply the medicine.
Patients are diagnosed.
Se le hacen sus análisis complementarios, se evalúa integralmente el paciente, se indican los complementarios necesarios y si reúne los criterios.
Patients are diagnosed. They do a medical test. They are entirely assessed. We identify their needs. Once they are examined by the specialist in the consultation and they have all inclusion criteria fulfilled and require a surgery or any other procedure, when the lesion is clean, the patient is.
Not all patients with diabetic foot ulcer can be included in this program.
No todas las personas pueden ser incluidas. El pie diabético tiene sus clasificaciones. A veces, desgraciadamente, a nuestra consulta.
Not all patients can be included. Diabetic foot ulcer can be classified. Sometimes some patients with a chronic disease come to us and they can't be included in this program. Some patients coming to the consultation are decompensated. They have vascular system or endocrine and metabolic disorders. It is necessary to improve their glycemia and control anemia. Once we get to compensate the patient, we proceed to apply the medicine.
Once you proceed to apply the medicine, how do you keep treating the patient?
The medicine has a program. You must apply 3 times weekly during 8 weeks. It is 24 doses. Once 24 doses are applied, the specialist in angiology and vascular surgery assesses the patient. Generally, patients with neuropathic lesion disorders, which means they don't have any ischemic component, any important circulatory disorder, they don't get these 24 doses. After 14 to 16 doses, the granulation tissue of the lesion is fully created. Then, the phase of epithelialization is produced without applying the medicine. Once the patient has got these 24 doses, they have completed the 8 weeks treatment phase, and we take into consideration if he or she needs of skin graft or anything else that helps to fasten the epithelialization because the granulation tissue is created thanks to Heberprot-P.
I guess this is an expensive treatment.
Sí, el Heberprot-P es un tratamiento costoso en muchos países del mundo, por ejemplo en Estados Unidos una úlcera del normal.
This is an expensive treatment. Heberprot-P is an expensive treatment. Worldwide, for example, in the USA, a treatment for diabetic foot ulcer costs $16,000 approximately. If he or she has an important ischemic component in many countries, we can talk about $24,000. If he needs more treatment, we're talking about $60,000. Why? Because we're talking about when we are treating a diabetic patient, we're only treating the foot ulcer. We can only focus on that. We must treat him or her entirely. Both diabetic foot complications and general complications implying the diabetes disorder. The diabetic foot disorder appears after 5 or 10 years of disease. But once a patient presents the diabetes disorder, other complications come along. It is necessary to treat this lesion along other complications that appear in these patients, and the treatment is expensive. Here in Venezuela, after the bilateral convention, the treatment is free for the patient.
The government pays, but the patient doesn't.
The government pays, but the patient doesn't. It is a challenge to the governments everywhere in the world with the high tendency of this disease, where a worldwide catastrophe is coming with the development and the tendency of diabetes mellitus cases. Now, we're talking about 400 millions, and by 2040, 600 millions.
Worldwide.
Worldwide, which means an epidemic, a catastrophe shading over the states and healthcare institutions. Healthcare ministries, all countries in the world are accountable for the impact of this disease and development of the diabetes.
How is the international medical community preparing for this epidemic?
The international medical community has a big challenge. Do you why they face such a big challenge? 70% of patients can prevent diabetes and its complications if we change our lifestyles.
How can we do that?
How easy is to prevent this disease? How can we do it? It is important governments wake up. Healthcare institutions worldwide, and especially here in Venezuela, wake up with this upcoming epidemic. They must set healthcare programs, but they must be programs seeking results regarding changing lifestyles of world population, and Venezuelan population specifically, whom we are talking about. We must change our feeding habits. We must create education programs and educate from primary school, beginning with the children, so they understand the need of changing lifestyles in their own lives, in their families, and the society. Women, little girls play an important role regarding changing their lifestyles to healthy lifestyles.
In the case of patients with a diabetic foot, are there more women than men?
There are more women in numbers, and women generally are who lead households, don't they?
Because of the patriarchal society.
If we educate girls and boys, since they are in primary schools, we teach them how to make the meals, how to do exercise more often, how to be less fat, how to leave computers, mobile phones and video games aside, and how to do exercise more often, and how to get ready to.
What is a healthy diet?
A healthy diet consists of, we don't call it diet anymore. In the diabetes world, we call it a food plan, agreed between the patient and the health specialist, the nutritionist and the society. Nowadays, we talk about a food plan. It doesn't mean we have to restrict our habits to eat some sort of products or different food groups. We can eat all those groups. All we need to learn is what time we can eat them and how to prepare them, so they have fewer calories. When we learn this from primary school, when regional authorities and health ministries raise awareness and implement plans where population stop eating fast food, refined sugar, trans fat, so then we will implementing programs on health, care education to prevent the effects, tendencies and complications of diabetes mellitus.
Are obesity and diabetes inherently related?
Sí, existe una relación entre la obesidad y la diabetes. Es lo que yo le comentaba anteriormente.
Yes, obesity and diabetes are inherently related. As I said before, food rich in refined sugar, fast food, sedentary lifestyle because obesity, and a frantic life plus the sedentary lifestyle self-imposed, I can assure you there are more children suffering from obesity. There are fewer healthcare programs for the children to do sport. Their lifestyles are dominated by computing, smartphones, video games. That's why video games must be developed in a way where kids don't sit in front of the computer, but where they have to move their body.
Interactive games.
A globalized world has led to a more sedentary lifestyle, becoming more obese and using less energy and eat more fast food. This leads to the development of diabetes.
What kind of treatment does a patient with diabetes receive once he has been treated with the medicine Heberprot-P?
Once the patient has been diagnosed under the inclusion criteria for the application of the Heberprot-P, we monitor during 8 weeks and 16 doses approximately. Once the patient has finished the treatment with Heberprot-P, that he or she is compensated and has entirely been attended, he or she keeps receiving medical attention from a multidisciplinary team. For example, a specialist in food habits, I mean the nutritionist who teaches him or her how to eat their food. The diabetic patient must know how to supply the medicine whenever he or she needs it. We teach him or her the auto-control themselves. We must know what to eat, how to apply the medicine to themselves, at what time he or she must test for the leukemia, if she or he has a high peak or a low peak in the early morning, and the most important following is the medical consultation with the angiologist. I mean the cardiovascular surgeon, both the ones in Cuba or the ones that we are here and the ones that are being trained here in Venezuela to teach the patient and his or her family how to evaluate the diabetic food of the patient on a daily basis.
Why is it important to create awareness not just in the patient but in his or her family as well?
It is important to create awareness not just in the patient but also in her family. That is a very important question because we live in family, we live together in family, and if there is an incident with the diabetes because there is a family heritage of this disease and there is not awareness in the family of how to care for it, how to respond to it, then the development of this disease could appear in another family member, a part of the one that is sick too. If we don't have awareness on how to eat healthy, that we must do some exercises, that we must have healthy living habits that influences in the one that is sick as well.
Because the diabetes is a disease that we can control but is irreversible. The person can be healed completely of diabetes.
Yes, the diabetes is a chronic, irreversible disease that when you are diagnosed with the disease, you will live with the disease your whole lifetime. If you don't learn how to live with your disease and you don't educate and teach your family member, it is very hard to a diabetic patient to live in an ambient which there is not an adequate education and awareness that there is a diabetic patient and the whole family must change their lives in order to improve their life and the one of the patient as well.
How has been the level of response of the Venezuelan patients to this type of treatment that the Cuban state has brought to this South American country, that the good living for the diabetic?
First of all, I wanted to congratulate Venezuela that a program for the good living for the diabetic, such an integral program as this one, it is very hard to implement, and little by little has been taking decisions through the health ministry to set up in all the states. Of the 23 states that we have implemented the program in 21 states, and 18 of them have with management of Cuban medical personnel. In these 18 years have been attended, and it has been 10 years of the first patient ever attended with the medicine. We want to make some group activities in order to celebrate all the activities done in the past years with the Venezuelan population.
When a Venezuelan patient comes to a consultation here in Venezuela, what does he or she say? How does he or she feel once that he or she sees that is evolving thanks to this treatment?
When the patient comes to the consultation with the multidisciplinary attention group of his diabetic foot, I think that the feeling that the patient has of us here is very satisfactory. It reflects in our interviews, in quite some interviews made to the treated patients, also in our webpage, in a book made by the Dr. Baldomero, that the President Chavez had the opportunity to see him and read it and refer to him about the testimonies of a lot of patients, thanking the attention of the Cuban doctors, and also thanking the possibility of the concerning to wanting to introduce the program, and also the medicine called Heberprot-P to the application for the ulcer of the diabetic foot. I think that I can say on a general point of view that there is a retribution of our work and the sacrifice it matters of saving their extremity and to rise up their living condition with their application and integral treatment of the diabetic patient.
What does the Cuban state think about expanding the medication not just in Venezuela, but in other countries as well?
Well, with the development of this medication, the Heberprot-P, the Cuban state and the Institute of Biotechnology and Genetics Center in Cuba has developed a commercialization program and exchange between some countries. In a global thinking, the global development of the medicine as well, because it has gotten recognition both national and international in the Medical Congress, in the International Fair, where it has been explained the mechanism and process and why this medicine is applied in an international way. Here in Venezuela, it is taking place a program for the medicine to be produced in a municipal way. Take to all the locations of the country the medicines, and in those locations who are widely up to make the medicine. Help to the other places that doesn't have the opportunity to produce it. So, the patient will have the chance to do the application as nearby as possible, such as CDI and Barrio Adentro, that he can be attended right there without moving to another place in order to seek the comfort of the disease, because the medication must be applied 3 times per week.
Yes, the situation for the patients gets complicated. Doctor, thank you so much for this interview, for Tell Us We're English.
Thanks to you.
On the treatment of Venezuelans who have been suffering from diabetes in this South American country, and the treatment has been held by the Cuban Medical Mission, we have been speaking in this show. Remember, this is From Caracas. I'm Ray Gomez. So thank you very much for joining us.